Thank you, Mariana, and thank you, Anna and Usama, for the invitation to this very amazing symposium. So, as you can see here, I come from this land of the magic realism, in which you can see that we use cable cars, not for skiing, but for providing public transport to the poorest populations that we have in the city. And that's what I'm going to be talking today about, the health evaluation of the cable car for public transport for informal settlements where you have high rates of crime, poverty, and density. And this is part of the Salurval study funded by the Wellcome Trust, but we also had funding from the Planning Department of the City of Bogota and from the Ministry of Science in Colombia. So cable cars are not only in Colombia. These are the documented cable cars that we have around the world for transport. And what I want to highlight is that we have the highest concentration here in Latin America. And this BC graph shows the complexity of the implementation of these cable cars with multiple built environment infrastructures, policies, and all these colors are different sectors. So in summary, for the cable car Transmicable, which is the cable car of the city of Bogota, we had community participation and leadership since the year 2008, thanks to the advocacy from another city, Medellin, that has the first cable car. We have had continuity of 4 governments from the left, right, and center parties, 26 built environment services and facilities, 18 sectors, including health, and also 6 public policies. So this is Transmicable. It doesn't go that fast. It's just a gift. And it was inaugurated in 2018. We have 4 stations, 163 cabins, and 3.43 kilometers in length. It has about 26,000 to 30,000 passengers per day in a population which is the poorest population we have in the city, with about 600 inhabitants. So as part of the Salurval project, we did this policy evaluation, which was to assess the effect of the implementation of Transmicable on travel time and also satisfaction with transport, personal exposure to PM 2.5, black carbon, carbon monoxide, and in transport microenvironments, physical activity behaviors, health-related quality of life, and we also use a qualitative approach with citizen science to identify barriers and facilitators before and after the implementation of the cable car on livability of this population. So we designed a natural experiment, the Trust Natural Experiment, in which we have the intervention area, Ciudad Bolívar, and the control area, which is the next cable car being implemented in the city. And we have in our study population, this population within this 800-meter buffer in both areas. We had an evaluation before the implementation of the cable car, and then 3 waves after the implementation of the cable car. On our quantitative component, we have about 1,000 surveys from each group. In the initial wave, we have an 82% response rate. Those are the main results I'm going to present. And right now, we had a 59% response rate in the last wave. And on our qualitative participatory component, we use our voice citizen science method. And for the harmonization of this data, we use simultaneous bidirectional integration of these data. So this is our study population, which is characterized by high levels of poverty. And in terms of transportation, the main mode of transportation in this area is public transportation. So we have mostly women, low education, low income, 91% uses public transport. And after the implementation of the cable car, 12% use the cable as a regular mode of transport, but at least 70% of the population have used the cable car at least once. So I will start with the result of the transport and air quality. Here you have the evolution of the transportation in the area from the donkey to the cable car. And this is back in the 80s, so not long ago. So what we found on terms of transportation was the average travel time for this study population, which was very high, but it decreased for transmicable users. About 22 minutes was the totally decrease, but what I want to underscore here is that it decreased more for males than for females, both on the vehicle and on the waiting time. On walking, we see a pattern that increased among females, but it's not very different. And the other thing I want to underscore is the satisfaction with the cable car. Is almost 9 out of 10 in a city in which the satisfaction that we have with our public transport is only 5 out of 10. So first, we measure these pollutants concentration using portable devices that you see here. And we had on baseline 99 trips that we evaluated, and then on the first follow-up 112 trips. So we evaluated the BRT feeder, the bus rapid transit feeder, the regular bus, which is the most important transport system in the area, the informal transportation, which is also very important, and then the cable car when it was implemented. And this is a time series of the monitoring that we conducted, so very high concentrations in the terminal. And then as we expected, in the cable car, which is electric, it decreases those concentrations, even they are lower than when we walk. And then in the cable car is lower, and in the terminal, again, is very high. So what we found, which is what we expected, but here we documented the reduction. The mean concentration of PM2.5 and black carbon inside the transmicable cabins were 62% and 82% lower than the mean concentrations in the main mode, which is buses, diesel buses, actually. So that was transport and environment. Now physical activity. As part of the renovation in the cable car, we also have the renovation of these 2 parks. So what we did was, at the individual level, objective measurements with accelerometry data, IPAC for assessing both leisure and transport domains and physical activity, and in the renovated parks we use a SO park. So this is the data on accelerometry. This is what you see here is that the MVPA, the moderate to vigorous physical activity minutes per hour, is higher for those users of the cable car. But I also want to underscore, look, we have activity since 3 a.m. in the morning. That's what we see in these women there. Waking up at 3 a.m., going to sleep at 11 p.m. Very long hours in a very poor population. So what we found after evaluation, this was that moderate to vigorous physical activity did not change. We don't see changes from the intervention to the control group, but we see that for regular transmicable users, physical activity MVPA was high and to continue to be high. And it's a mode that they feel they are more satisfied with, which is what you see when you evaluate physical activity that is conducted out of necessity. And it's out of necessity because this is what we find mainly, that the main mode of the main domain for physical activity is walking for transport more than leisure activity. And that's what we also want to highlight in the framework in the developing world, that it's many of the physical activity that we do is out of necessity, so we have to improve the satisfaction and the safety in the area. And in terms of the parks, what we observed was higher proportion of male individuals engaging in MVPA, but we didn't see that pattern among women. And then with health-related quality of life, what we found, which was very important for the female population, was that women in the intervention area reported 6-point increase in the overall quality of life. This is what we see here. We don't see the same pattern among men, and we see a difference between the intervention and the control group. So what happened with the qualitative component? So we first collected data with the Stanford Discovery app to see barriers and facilitators. We, in focus group, discussed and analyzed that data with our community members, and then we facilitate the results being presented to the stakeholders so they can show the priorities in the area, and then we monitor the changes using a ripple effects mapping. So what we found when we compared quantitative and qualitative results were mostly convergent and complementary results. So basically shorter travel times, like I show you in the quantitative, increased satisfaction with public transport, but there was a problem with the cost. The fares were high for this population, especially for short trips. They were happy with the increased access of parks, but women needed more programs for physical activity, specifically aerobics and what we love in Latin America, which is dancing classes. And also, very important, it was something that emerged and that we didn't find in the quantitative component, a reduction in the neighborhood stigma and increased pride in the community by this implementation. The other thing that was important is what the citizen scientists from the intervention group recommended the leaders from the control group, the next cable car, to have and establish effective institutional communication channels for the implementation of cable car. Community participation was underscored. And for the stakeholders, the Transmicable manager highlighted now the importance of collecting public health data. That wasn't in the agenda before. Second, the Secretary of Women found great interest on the differences that we found between men and women, and now are using these arguments for the policy, the next policy on blocks of care for unpaid caregivers that are mostly women in the area. So for dissemination, we were happy to have in the front page of Lancet Global Health the cable car, but we actually were more happy to have that news in the main newspaper of main newspapers in Colombia, in which they actually highlighted the importance of health and transport. And even more important, this was a community piece, a storytelling that is being used in the cell phones of our communities. So communities are advocating for these cable cars, and also the control group that now is going to have a cable car the next year is using this for continue advocating for other co-benefits of the implementation of this transport system. So in conclusion, what we have found for this evaluation is that Transmicable and its urban transformations are an example of potentially inclusive, sustainable, and healthy intervention. For the transport area and the planning department, it was important to see that interventions in public transportation generate benefits that go beyond mobility, especially health was now a component in this evaluation. Just to summarize, we found reduction in travel time, satisfaction with transport, reduction of commuter exposure to traffic-related air pollutants. Physical activity among Transmicable users is high and continue to be high. So we are promoting a behavior that is doing out of necessity, now with better conditions for these users. Quality of life scores were increased among women, especially in the qualitative component. We saw that they have a little bit more time for leisure activities, decreased perceived social stigma. And as I showed you at the beginning, this is part of the Salurbal project, and it's part of a project that was co-created with policymakers and communities. So I want to underscore, and we saw that in the first presentation, that national and international networks with true partnerships between academia, community, and policymakers have the potential to provide a better understanding of the effect of urban interventions aimed at promoting more livable cities. So we also underscore this partnership for the development of these studies. This is the amazing group that has been part of this intervention and this evaluation, and gracias.